Throughout the day, we have various briefings of people, experts on the topics that are in the news. And today, we're very, very happy to host Dr. Efrat Harlev. Dr. Harlev is the CEO of the Schneider Medical Center. Dr. Harlev and her team treated 19 children that were kidnapped by Hamas terrorists and released over the past 10 days. And that is the highest number of any hospital here in Israel taking care of children in this crisis. This is a very, very unique situation, and Dr. Harlev will update us on the status of the children and will be welcome to answer your questions. If you are here on the floor, please raise your hand when she is done with her opening remarks. And if you are watching us by Zoom, please write it in the chat box, and I will repeat the question to Dr. Harlev. Thank you. Please, Dr. Harlev.
Thank you very much, and good afternoon. Maybe I should start with just a little bit about who I am and what is Schneider Children's. So I'm a pediatric critical care physician in my profession. I've been a physician for almost 30 years and the CEO of Schneider's for the past 3.5 years. Schneider Children's is a hospital that is dedicated to children in Israel, a tertiary care center. In our cornerstone, it says that we are dedicated not only for the children of Israel, but rather for being a bridge for peace for the surrounding area and for Israel. One example is that about 1.5 years ago, we brought about 12 children from the Ukrainian war because we believe that children are above and beyond any politics, any gender, any race, any religion, and children are above and beyond. At this war, since October 7th, we actually did not receive any children at first. And the reason that we did not receive children at the beginning of the war is that there simply were not any children. Most of the children on October 7th were massacred, did not stay alive. And the ones that did survive were kidnapped. And so during these last 10 days, and I should say even much more before that, we've had a vision, we had a dream that we will be the ones to be able to accept those children once they're back. I should say that to be a pediatrician, many people ask me, how can you be a pediatrician? It's such a difficult profession. You see sick children. And I always say, especially in the ICU, that it's the most optimistic medical care that we can give because most children recover, even in the most extreme situations. But none of us could imagine, not even me, that I see the toughest children that come to us during these last 30 years, the toughest conditions, the toughest medical situations that we have to deal with. None of us have seen such a tough situation as receiving those 19 children, 6 mothers, and 1 grandmother back from captivity during these last 10 days. And when I say tough, for us tough is not their medical condition. What I can say about their medical condition is that they all came back very skinny. Some lost between 10 to 15% of their weight. So you can probably imagine a 3-year-old child that has been in captivity for 50 days or more, coming back much skinnier than on the 6th of October when she was still celebrating Sukkot and having a good time. When we gave these children food, and we had to give them very precise kind of feeding in order for them not to be overfed at this minute, we saw how they were eating. They were not eating. At first, they were picking on the food. We gave them food, but they were picking on it. They were eating such small bites. And when their family asked them, why are you eating such small bites? They whispered, because we have to keep it for later. I don't think the children of 3 years old of 8 years old should be in a situation where you have to think about how you save your food for later. We heard stories of two sisters being together in captivity with nobody else around them, and the older sister deciding how much she will eat so that she can keep some of the food for her 8-year-old sister. So she would not eat for days, so that her young sister should eat. Can you imagine such a decision being made by a 15-year-old girl? The last time that I've read about it was about 80 years ago in the history books of us, Jews without their state. But this is the easy part. This is the easy part because we know how to feed children. And we've done it for the last 10 days, and we've seen that they finally do eat. But the hard part is how to treat their soul. We have a very large team at Schneider Children's of social workers, of psychologists, of psychiatrists, again, that have seen the worst in 33 years of Schneider's. We've seen terrorist attacks with children losing their parents and being hurt themselves. We've seen terrible accidents. We've seen children with the worst diseases possible. And we know how to treat both the children and the families physically and also emotionally, because we have that experience. But before these children came to us, one of our challenges and one of the things that we were thinking about is that we really don't know, we just don't know how to treat those children. We read anything possible about children in captivity, with their families, without their families. Things have happened in different places. But an event like this, of children facing what they did on October 7th as an event by itself, and then being in captivity in such a horrific place for so many days, with or without others, with or without knowing what's going to happen with them, what's going to happen with their parents, this is something we did not know how to deal with. So one child told us, I actually thought that everyone forgot about me. Why did I think that way? Because this is what I've been told by the Hamas kidnappers. They told me, she said, that nobody cares about you anymore. Nobody's looking for you. Nobody wants you back. You can hear the bombs around. All they want to do is kill you and us together. A 13-year-old girl, this is what she has to hear for 50 days. So she comes back, and now, first of all, she has to believe that we were looking for her, that her parents were looking for her, that they cared about her. This is not something that takes a day or two even to start understanding how you make that child believe. The interesting thing is that children are children. I got all of them. I went all the way to the helicopter in our heliport at the medical center to get them. I went on the helicopter to greet them, to see how they are, to see if they need immediate medical care, just to watch them as we do in a triage, a fast triage. And I looked at them, and they looked at me back, said, welcome. They looked like shadows of children, not like children. They looked like shadows. And children are just so strong that while we had them, and we still have them, during those days that they were with us, first you listen to them, you look at them, and they say almost nothing. Or they whisper, or they ask very quietly, can we look out the window? Can you imagine a child asking if he can look out the window? Can I open the drawer? It's your drawer, honey. It's yours. It's your bed. You can open any drawer. Can I go to the shower? Many of them have not showered since their kidnapping days, or have showered with a cold bucket if they were lucky. Can I go to the shower? Wow, there is warm water here. Can I walk out of the room? These are the kind of questions that we heard very silently during the first day. I think that we saw the first smile of many of those children maybe after 24 or 48 hours. And this smile that we first saw gave us a lot of hope that children, like we see them in other conditions, are just enormously strong. That these children, no matter if they're 3, 8, 13, 16, they will overcome with our help. And with their help, I think it's the nature of children to recover. But we also know that after this smile come so many questions, and they did. They started very quietly, but they continued with lots of stories that they told from captivity. Lots of stories that a mind can actually not imagine. That a 3-year-old child would tell a story about the red man that she saw next to her. And to understand that that red man was someone that she knew that was covered by the blood so much that the only way that she could say to her mother, I saw that red man on the tractor, it's because she was covered with his blood and he was just red of blood. I don't know how many of you remember different things that happened to you while you were 3 or 4. I try to think about it during the time that I'm not in the doing, but in the being. And I remember some things. I remember some events. I remember some good things, and I remember some bad things. And when we try to look back at those children and their horrible stories, the only thing that I try to think, the only thing that when we sit together in our multidisciplinary team is to ask ourselves, when they're our age, in 40 years from now or 50 years from now, how do we make this memory a memory that will make them better and stronger people, and not a memory that will ruin their lives? I think this is our greatest mission now as caregivers. I say in many situations that we put a lot of we put a lot of question marks and not exclamation marks of what we do, because I don't think that any of us really know what exactly we should do. Each and every one of those children, each and every one of those families have 3 periods in their lives as I see it. One period is until October 6th. And as any of us, we have different lives, we have different families, we have different characters, we are in different ages. And that's until October 6th. Then there is October 7th. October 7th is a whole chapter for these families. And the 3rd chapter is the captivity. And when people ask me, how are they, what are the stories that they're telling, this is not one story. These are just, if you're into math, this has so many small parameters that we now have to take into consideration of these 3 chapters of their lives in order to understand how we're going to treat them further on. So you might see on some photos, and you see the photos, especially from our hospital, a family come together, 3 children, a mom, a dad, sometimes just a mom, sometimes there is no mom or dad. But you see a child smiling to the camera. This is a hollow child with a smile, with hope, with the future. But what these children have gone through is simply unimaginable. And we have to go one by one for all these 36 children still waiting for 2 more to make sure that when they do grow up in a place like Israel, they grow up to be strong, healthy, understand what has happened to them, and help us help them recover from this disaster. If you have any questions, I'll be very happy to answer.
Thank you, Dr. Harlev. Are there any questions from the floor? Yes, please. Please introduce yourself.
Thank you for speaking. My name is Aaron. I'd say my first question is how much of the testimony that they are providing has been recorded and can be made available to the press? Of course, there are a lot of people who are questioning why they can't be questioned.
So when we prepared for the first family to arrive, we spoke and we're working very closely with the IDF officials and other officials of the Israeli team. And we asked that let us first see how they are, and then if we see that they're okay, that the family is okay, you can go in and talk to them. And we heard many stories, but we are physicians. Some of these stories have been documented. I don't know if recorded, but definitely documented. It is definitely not our position to decide what is going to be revealed and what is not, for different reasons, I believe. But definitely many of those children, even young ones, told in detail many of the stories that I've just told you.
How many, how tricky or potentially damaging is it to go over that testimony with the children?
It's very tricky. And this is why in the action of receiving this information, we take our time. At first, as I said, we just look. And then we listen. We don't ask any question. We listen. Some of them, not many of them, but some of them have not talked at all. They answer yes and no questions, maybe like, do you want to eat? No, yes, that kind of questions. And you feel it, that you cannot get closer. You just feel it. Others really talk. And they talk again and again, and each time they bring out another story and another story. Their mothers as well, of course. And it's amazing, but it's the same with the adults, the same with the mothers. You hear a certain story, then it continues, and it continues. And it gets deeper and deeper. But most of the time, we really don't need to ask. If we do need to ask, it's for us as the medical team, it's mainly if we see that there is a purpose for treating them according to their answer to a certain question. If there is no purpose for that, I'm not going to ask something just out of curiosity. And I think that the same is true for other teams that are asking and recording or documenting. I think that we ask at this point questions that have a meaning for the future or for others who are in captivity. And we ask only when we are sure that it's okay to ask. And sometimes it takes days.
Sorry, Dr. Lorenzo Cremonesi from Italian Press, Corriere della Sera. Thank you for having the patience to talk with us. Of course, it's very harsh. I think everybody of us think about when he was a child and some of the trauma which are incomparable to what happened to these children. But I would like to try, since I assume will be for us impossible, very difficult to talk with any of them for obvious reasons. If you can give us some of the common patterns, some of the common elements that these children are telling you. There are three moments in this tragedy. The first is the attack. They saw the killing of their families, the horror, the worry. Then the transportation. Here in this room we saw this terrible video of, we see the car arriving, you told us about the red man, etc. So the transportation. And the third, the captivity itself. Can you give us some of the elements, the main elements, the common element of this story that you have from these 19 children? Thank you.
It's very interesting that about the event itself of October 7th, I think maybe that I heard just one child talking about it. They don't talk about it. You hear about it from their parents or from relatives that were around, if they were around. And I think it's too hard for them to talk about it, and we're not asking either. I think that maybe one child talked about the event itself. Transportation. So the one example that I gave was about the transportation. She remembered the tractor that she was on, and I think that we saw that on the news in many events, these tractors that they were carried on. But mainly they talk about these days in captivity. Many of them talk about feeling very hungry, very, very hungry. Many of them talk about feeling very dirty, not being able to clean, not being able to go to the bathroom. But I think that most of them talk about needing to be very quiet at all times, not to stand up, not to talk, of course not to cry, not to laugh, just to be very, very quiet. Many of them talk about the way that they were transported from one place to another. Many of them were not in the same place all times. So these are the older children, of course, not the younger children. But they talk about that. And you can just hear from the way they tell it how afraid they were to move from one place to another. They didn't meet a lot of people. Some were underground, some were overground, some were both for different periods of times. They met very, very little people during those transports. Very few people. Very few people. But mostly, what we hear again and again, more than being hungry, is that they just had to be quiet and were scared to death if they were not.
Again, Aaron Porce with the Media Line. You look understandably emotional when speaking about these testimonies and these children. Can you maybe speak to something that was particularly harrowing or that sticks out in your mind?
Particularly, I'm sorry?
Particularly heinous or difficult for you to hear?
It was the happiest moment and the saddest moment for me to hear that it was the first time in so many days that they felt safe at Schneider's. They did not believe that they will survive. They did not believe that anyone was looking for them. And it wasn't a matter of belief. We heard again and again that Hamas were psychologically harassing them on a daily basis. You're not going to go back. There is no Israel anymore. There is nowhere for you to go back, and nobody's looking for you. We've heard it again and again from them. So to hear that sentence, we can't believe that we're here and safe, is the thing that hurts the most and of course the happiest thing to hear.
Dr. Harlev, thank you very, very much for joining us. I know there are several journalists that want a one-on-one with you now, so thank you very much for joining us at the Press Center here today, and God bless you for your wonderful work, yours and your team. Thank you.
Very much.